See, can I make this large?
Okay, so let's do number 82. We're starting off with number 82 in the CPC Practice Exam. Let me know when you're ready, Pumpkin.
I'm ready.
Okay, let me get a swallow here. All right. So a 50-year-old gentleman with severe respiratory failure was mechanically ventilated and is currently requiring multiple intravenous drips. With the patient in his intensive care unit bed, mechanically ventilated in the Trendelenburg position, the right neck was prepped and draped with betadine in a sterile fashion. A single needle stick aspiration of the right subclavian vein. Okay, you already see that highlighted, right?
Yes, ma'am.
Okay. Was accomplished without difficulty. The guide wire was advanced and a dilator was advanced over the wire. The triple lumen catheter was cannulated, okay, over the wire, and the wire was then removed. No PVCs were encountered during the procedure. All three ports of the catheter was aspirated and flushed blood easily and were flushed with normal saline. The catheter was anchored to the chest wall with butterfly phalange using 3-0 silk suture. The betadine ointment and the sterile opsite dressing was applied. Stat upright chest X-ray was obtained at the completion of the procedure to ensure placement of the tip in the subclavian vein. Okay, now in this particular coding that we're going to be abstracting from, and I've already highlighted the things that you needed to pay attention to. Do you see me holding this up?
Okay. Yes, ma'am. I got the same thing on mine.
Okay. Great. Mm-hmm. Okay. So now let's go back through it and let's abstract information. Okay. So we're going to take out information to help make sense out of what we need to code. Okay. So the right neck was prepped and draped with betadine in a sterile fashion. A single needle stick aspiration of the right subclavian was accomplished without difficulty. Okay, so that's a procedure. A single needle stick aspiration of the right subclavian vein was accomplished without difficulty. So we're going to go to our CPT coding book. We're going to go to that. Give me a minute. Okay. So let's go to the back of the book and let's do needle. Let's start off with needle. Okay. So we found needle. Did you find needle in the back of your book?
Oh, you want me to get out my ICD-10?
CPT.
Oh, CPT, I'm sorry.
Okay. CPT.
All right. You want me to go to needle?
Yes, ma'am. Yes, ma'am.
MN.
A single needle stick. Okay.
Okay, needle. What was that? What we was looking at? A single needle
aspiration.
aspiration. Okay, I don't have aspiration. Needle. We're looking for the other. Let's see. Well, advance over the wire. Under needle, that's needle biopsy. That's not needle.
Okay.
Needle localizer, needle. I only have needle localization.
Okay.
Needle biopsy. Needle mamminometer NMT technique. Needle wire. And that's the only thing I have on my CPT for as far as needle.
Okay.
Needle. I don't see anything else that I would go under. Needle, single needle, thick aspiration of the right subclavicle. That's salivary gland. Let's see, guidance. It's just in the vein. That's not even CT. Was accomplished without difficulty.
Okay. Right, so Clavian, the guided wire was advanced and a dilator was advanced over the wire. The triple aluminum catheter was cannulated over the wire and the wire was then removed. No PVCs were encountered during the procedure. All 3 ports of the catheter were aspirated and flushed blood easily and were flushed into normal kidney. Okay. So this obviously was an insertion. Go to in your book. Go to 36557. Go to 36557.
Oh man. 365. 3655. You said 365. Okay, 36557.
Mm-hmm.
Insertion of the
tunnel. Go ahead.
Central venous catheter. Okay, that's 36557 through 36558. Okay.
Right. So I'm reading the rationale in the back of the book. So you can choose 36557 and you can also choose 36558 because the patient, let's see here, insertion of tunnel centrally inserted venous catheter without subcutaneous port or pump younger than age 5, than age of 5. Okay. Then you have a tag-along code. A tag-along code such as 36558 is by itself. It says age 5 years or older. So you really need both of them because the patient was 50 years old. So age 5 years or older. So you're going to do 36557, and we're going to talk about how they came up with that because you got to understand how the code happened. Oh, girl, I left this plate of food in here. Oh, Lord. All right, then, Jesus, help me out. Okay. So when you're coding, when you're on the CMS form, and that's going to be box, I think it's going to be box 24, and it's going to have 1, 2, 3, 4, 5, 6. You're gonna put on the first line 36557, and then the second line 36558. Just like this. I'll show it to you. On the CMS form in box 24. First line, because it's usually like 6 lines. First line, you're going to put 36557. And second line, you're going to put 36558. There should be an 8. It don't look like an 8, but it is an 8.
36557 36558. Okay.
Yeah. So let's go back and get an understanding of how this code came to be. Okay. Now this is listed under insertion of non-tunnel centrally inserted central venous catheter. Okay. So I circled a word catheter is put in here, is the main word up here, but we have to understand that there was an insertion, a single needle stick aspiration of the right subclavian vein was accomplished without difficulty. The wire was advanced and a dilator was advanced over the wire. Okay, look back at this sentence structure. A single needle stick aspiration of the right subclavian vein was accomplished without difficulty. So they had to insert that needle into the place of the right subclavian vein. Then the wire was advanced and a dilator was advanced over the wire. Okay. So the guide wire was advanced. Okay, so once they made that insertion with that needle, they were able to go in on top of it and put in a guide wire while they were in there. And then after they did that, then a dilator was advanced over time. So this was an insertion of a non-tunneled, centrally inserted venous catheter. Let me read the prime print of this. During the placement of a central venous catheter, a short track is developed as the catheter is advanced from the skin entry to the port venous cannulation. The catheter tip must reside in the subclavian, innominate, and iliac veins. The inferior or superior vena cava or right atrium to be considered a central venous catheter. Okay, and it should have a picture of this in your book. Do you see the picture of it?
You're talking about hold on. Oh, where's my book in my left? I'm sorry.
Okay.
I'm like, what book she talking about? Okay.
Okay.
Oh, yeah, right here.
Okay,
Yes.
so do you see the picture of the man and how they had to go in?
Yeah, because one is a child and one is a man. Okay.
Okay, but look at the picture under 36556.
Okay.
So a right subclavian vein entry site. Okay, just like they said, a right subclavian vein entry site. So once they made that entry site, then you have the right axillary vein, the right cephalic vein, and the superior vena cava of the heart. Okay, then they say a guided wire was advanced and a dilator was placed over the wire. It was placed, they had a wire in there. So once they made an entry in there, it was easier for them to tunnel a wire and dilate it and then put a cannulation there. And usually the cannulation would hang outside the person's body. So they would make an opening to have the cannulation there. And I believe this is for purpose of probably for like chemo or some other things, infusion therapy type procedures. Do you understand what infusion therapy is?
Yes, I used to get my MS medicine infused through my vein. I used to go to the cancer center to get that done. So
okay.
yeah.
Okay. And so have you ever had this kind of procedure done or a similar procedure?
No, not this right here, not like that. I just had infusion, like they will go through the IV in my hand to give me my medicine, and they will mix it up that same day. They will order it the day before and mix it up that day, and then give it to me.
Okay. Okay. Well, this is what this is talking about. So I'm just trying to help bring light as to what this is talking about. They made then they took a guided wire into the entry of the inside of the needle. Then they added a dilator inside of the needle. Then they were able to place a catheter cannula inside of that. So we had to go through the term non-tunneled. We had to go through insertion. So let's go back to the back of the book. Let's go to the back of the book. Let's find the word insertion. Find the word insertion. Let's find the word insertion.
Insertion. Enter. INHI. Okay, I'm in the index to insertion.
Okay. So let's see. Our answer choice was 3, 6, 5, 5, 7, and 8. So let's look at this. Okay, go to Venus. So we go to insertion.
Okay, I have Venus.
Okay, and it tells you all the things listed under Venus because looking at that picture is located in a major artery. So
we either got
so they also have 3655 to 3658. So it's covered under Venus. So when we go to find
okay.
Go ahead.
No, go ahead. It's only 2 sections under the Venus access device.
It's only 2 sections.
Well, you know, we in the index. You told me to go from insertion, then go to Venus, and it's saying Venus access device is either going to be central or peripheral. That's my only option. So, but we're talking what I just.
Wait a minute. Hold on. Wait a minute. Hold on. Let me go back.
But I got a 2020 book too, though.
I know, and I have a 2018. I know it sucks. It really sucks.
Let me go back to our.
Okay, great.
I have to pull this. Okay, catheter. Move. No PVCs were encountered during the procedure. All 3 ports to the catheter were aspirated and flushed. Blood easily were flushed with normal saline.
Mm-hmm.
The catheter was anchored to the chest wall with butterfly phalangeal using 3F0 silk suture, betadine ointment, and a sterile off-site.
Mm-hmm.
Dressings were applied. Stat upright chest X-ray was obtained at the completion of the procedure to ensure proper placement of the tip in the subclavicle vein.
Mm-hmm. But go back to insertion. Go to catheter. Go to the word catheter. That's what I meant to tell you.
Okay. Okay. The triple lumen catheter was cannulated.
Right.
Okay. You have that underlined, cannulated, and I'm not sure what cannulated means either.
Let's Google it.
Okay. All right.
It could be tunneled. Cannulated is like tunneled.
Okay, I'm gonna see what they said the definition. Cannulate. Introduction to cannula or thin tube into a vein or body cavity. So I guess it goes in with what we're talking about too.
Exactly. Exactly. Right. But now also go back down to insertion and go to the word catheter. Go to catheter.
You say catheter under insertion. Okay, hold on. Okay, I have catheter. Okay. Yes, ma'am.
Catheter.
But we're talking about
and then go venous.
Okay. 36011. But there's so many under there, so we can start from there and then kind of.
Yeah, you can start from there and kind of work that way. But what I'm trying to get you to see is how to abstract the word. So we're matching words here, that there was an insertion of something into the a single needle stick. That's an insertion.
Mm-hmm.
Okay. The next thing you want to look at is that catheter. So we look up insertion. That's a procedure of going in. Then after the insertion, there was a catheter. We're going to find catheter under insertion. And then now we have cannulated, okay? And cannulated inside, let's see, was it no PVCs? Okay, all ports of the catheter was aspirated and flushed easily, were flushed by normal saline. The catheter was anchored to the chest wall, okay, with butterfly phalange, betadine. Okay, so there was a big area. But that's what it was. If you look about the subclavian is right near up here. This is the clavicle. So the subclavian is right up here.
Okay.
And then it says on the right side. So this is okay over here. That's right. Because the circle of blood. Okay, the circle of blood. Red goes to the left, blue recirculates to the blue. I mean, red goes to the left, blue recirculates to the right. So that's the circulation of blood. But the insertion that went into the right subclavian, and then a catheter was put in, and then it was cannulated. So you can thumb through all those numbers, but on the test, look at your codes and try to match what's inside the listed numbers under venous. That's what I'm trying to get. So what I'm trying to get you to see is that they made an insertion through the right subclavian, and then they placed a catheter. See that catheter highlighted? And then they cannulated into the venous area. So you kind of match out your numbers in order to know which one belongs to the answer. Does that make sense? But in the real world, I want you to know how to see it as such without having the answers in front of you. Because you're not going to always have that choice in front of you. You might have on the software where it's going to help you edit some procedure codes, and you have to know how to pick the right ones. Am I making sense, sweetie?
Yes, ma'am. You're trying to. I think this is how this lady I've been watching on YouTube.
Oh, good.
She'll read the statement. She'll read the answers, and then she'll give the students time to answer. And then she'll break it down like a quicker method to help you find the answer. I've been trying to pick up on that. I think it's kind of like what you're doing.
Okay. Yes. 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 Okay, sweetheart. Okay, well,
it's like a method of you she said, because you're timed, so how to be able to find the answer, because you're going to be timed too.
Right.
What, 150 questions? Only, what is it, 4 hours you got or something?
Yeah, something like that. Something like that. Something like that. Mm-hmm. Mm-hmm. All right, let's do number 83. A patient with chronic emphysema has surgery to remove both lobes of the left lung. Both lobes of the left lung. Okay. So
we picked which 82? Which answer we picked?
Oh, for 82. I'm sorry. We picked 355. I'm sorry, 36558. But you got to have 36557 to conjoin it, because you can't have that standalone code. That's a standalone code that says age 5 years and older.
Okay.
So you have to have 36557 with that in order for it to make sense.
Okay.
Yeah. Remember, I showed you that this is how it has to look. So you can't go with just one. So you're gonna have to circle both. If you circle either one, that's fine. If you do 36558, that's fine. But if you do 36557, it's wrong. But on the test, if it gives you a choice, like it does here, then choose 36558.
And that one's it
says age 5 years or older.
5 years old, okay.
Because it falls under that 36557. That 36557 explains the detail of the code, but that 36558 is an addition to that to differentiate the age. But if you had to choose on the test, choose 36558.
Okay.
Yeah, choose 36558. Okay, sweetheart. You ready to move forward?
Yes, ma'am, I'm ready.
Okay. A patient with chronic emphysema has surgery to remove both lobes of the left lung. Okay, now you got 32440, 32482, and you have 32663 times 2, and then you have 32310. Okay, so let's look at C. C looks quite clear, but it may not be. So let's look at C. Let's go to the book, inside your book, and let's do 32663. 32663.
32663. You said 3-6.
3-2, sweetheart. 3-2. 663.
Oh, 3-2.
3-2, 663.
Three, 3-2-6-6-3. With lobectomy, single lobe. Patient with chronic emphysema had surgery to remove both lobes of the left lung. Okay, this one's only saying.
Okay, so 3-2. I found it. Hold on, baby. 3-2-6-6-3 with lobectomy, single lobe. Okay. Now this all falls under, these are standalone codes because it doesn't give a complete sentence. It only just talks in fragments. So the main code, hold on. Okay, so the main code is 32650. 32650 says thoracoscopy, surgical with pleurodesis, that is mechanical or chemical. Okay. And then it has all this data of what else can be inclusive to that code. And so we look at 32663 with esophagotomy, with lobectomy, and then you do it twice. Let's go back to that code, that major code. Major code is 32650, thoracoscopy, surgical with pleurodesis. And then we look at 32663 with lobectomy, single lobe. And then you do it times 2. Okay. All right. So let's keep our mind on that one. Let's look at 32440. Let's look at 32440. 32440. Okay. So this one here is removal. Okay. Removal of lung pneumectomy. Okay, that sounds about right. Okay. Then you have 32482. 32482. 2 lobes. Okay, so the major code is removal of lung pneumectomy, 32440. But then you have the tag-along code, 32484, single ectomy. Segectomy. So 32482. Okay, it says 2 lobes. I'm sorry, it says 2 lobes. Okay. Let's look at 32310. Then we'll wrap that up. 32310. Okay, no, it's not 32310. And it doesn't appear to be 32663 times 2. It may be 32482. So let's go to the back of the book. Well, let's go to the rationale, is what I meant to say.
32482. 2 lobes under removal, and it's under 2 lobes. Biblectomy. Did I say that right? Biblectomy. I guess did I say that right?
I think so.
Okay, and then we're actually talking about 2 lobes. So we go back to what the thing said: a patient with chronic emphysema has surgery to remove both lobes. Both means more than 1 lobe, so that'd be 2 lobes because you only got 2, a right and a left. Okay.
Now the A is okay. It says right lung has 3 lobes. When 2 lobes are removed. Oh, good. Good. Okay.
I had to go back and look and see which one did I write down. Oh, I got that one. Okay.
You
I wrote
did
down
good.
32482. Okay.
Mm-hmm. You did good. You did good. I'm proud of you. Okay, so it says when the entire lung is removed, it's called a total pneumectomy. The left lung only has 2 lobes, so the heart has room to expand. When one lobe of the lung is removed, it's called a lobectomy. So when lobes are removed, it's called a pneumectomy because the entire lung is being removed. The question describes the left lung. Yeah, the left lung. So 32482 and option B is incorrect. Code 32482 describe a biblioectomy, but in the case of the left lung, that would be the entire pneumectomy. Pleurectomy is the removal of the pleura, not the lung and its lobes. In this scenario, the total pneumectomy was performed in open fashion. Code 32663 and option C describe the laparoscopic procedure. So A is the choice answer, removal of lung pneumectomy. Very good. Very, very good. Now, did you see, is pneumectomy in the reading here?
It's just saying both lobes, remove both lobes is what it's saying. So
Yeah.
So it says those 2 things.
Okay. Very good. Very good. All right. Proud of you. You give yourself a hand. You did good.
Yeah, I was questioning that when you gave me the homework. I was like,
good. You did very good. You did very good. You even did better than me. Amen. And that's good. I'm proud of you.
Okay, we have 80. We didn't do that together, right?
80?
I don't think so.
80? You said 80?
No, yeah, number 8. Did we? Let me go back and look.
Did I send you?
No, that was 81. We didn't do 80. Okay.
I don't think I sent you 80. No. Did I send you 80?
I have it, but I don't have nothing highlighting stuff. Yeah, you did send me that. I have that.
Okay.
It's about the 59-year-old female.
Yeah. Okay. I didn't know I sent you that. Okay.
Oh, okay.
All right. Well, let's work through that. Let's work through that. A 59-year-old was brought to the operating room and placed in a surgical table in a supine position. Following anesthesia, the surgical site was prepped and draped in the normal sterile fashion. Attention was then directed to the right foot using number 15 blade and 6 centimeter linear incision was made over the first metatarsal head, taking care to identify and retract the vital structures. The incision was medial and parallel to the extensor hallucis longus tendon. The incision was deepened through subcutaneous, underscored, and retracted medially and laterally, thus exposing the capsular structures below, which were incised in a linear longitudinal manner, approximately the length of skin incision. The capsular were sharply underscored off the underlying osseous attachments, retracted medially and laterally using the osteotome and mallet. The medial eminence of the metatarsal bone was removed and the head was remodeled with the Leiston bone forceps and bell rasp. The surgical site was then flushed with saline. The base of the proximal phalanx of the great toe was ischemized approximately 1 centimeter distal to the base and excised into the surgical site. There was no hemiplant used, and Kirschner wire was used to hold the joint in place. Superficial closure accomplished the Vicryl 5-0 in a running subcutaneous fashion. The site was draped comprehensive dressing. The tourniquet was released. Excellent capillary refill to all the digits were observed without excessive bleeding noted. Okay, so here's the rationale. Number 80. Oh, here it is. Here it is. Here it is. Let me take a picture of it so you can have it. Did I give you the pictures of, of the other rationales?
No, you just gave me this just a question and the answers.
Okay.
Oh, you talking about as we break it down? Once I think as we look up stuff in the CPT book, I think it will give me, the pictures on some of the procedures. I did notice that.
Okay.
It depends on what the procedure is.
Okay. Okay. I'm going to send you pictures of the rationales so you can have that.
Okay.
I think we did 81 together, right?
We did. Mm-hmm. That was a surgical one. Yes, ma'am.
Okay. Send you this one. And let me send you this one. What number did I stop when I sent you homework? Did I stop at 84?
I have to go back and look. We must have just went to just those.
Okay, and then I sent you some.
You didn't ever send me 84. I think you were supposed to, and I got 80 instead of 84. Because after the 82, 83, then I see the picture for 80. So maybe you meant to send it to me. I didn't get it.
Okay. And then the 5 homework assignments. Let's see, did I send you? What was I sending you? Number 1.
Medical terminology. I think that's 1 through 5.
1 through 5. Okay. 1 through 5.
Under medical terminology section.
Oh, yes. Okay. So let me send you the rationales for those. Okay. I'm about to send it to you. Give me a few minutes. Okay. Let me know if you get them. They they're appearing sideways, and I apologize. I don't know why they went out to you sideways.
Did you email it or are you texting it to me?
I texted to you. You prefer me to email?
I just ain't got the text.
Okay,
No. I just haven't got the text yet. I might have to turn my phone on and off.
Oh, okay. Do you want me
Sometimes it'd be slow to get stuff.
Okay, well let me.
Oh no, I got it now. I got it.
Oh,
I got it.
Okay.
It's just my phone.
Okay.
It's slow to get stuff.
Mm-hmm.
Okay. Let me.
Okay, so let's go back to number 80 and let's read what that is. Let's read the rationale. That's where we were. We were reading the rationale.
We looking at number 80, the one we on now, the rationale.
Mm-hmm.
Okay, that one is 82. Let's see. Okay. All right.
Okay.
Let me get my back over. Okay.
So go to B. And then it says the answer is B.
Okay, so we're going to the rationale with B.
We're going to the rationale that has number 80 on it. The answer key.
Answer key. Okay, B. Most CPT books have diagrams with detailed descriptions accompanying these codes. These diaphragms will direct you to the correct code. 3 of the 4 options are here incorrect because they include procedures not documented in the question.
So code 2898 in option A is the accompanying diagram depicts the removal of the medial eminence and the Kirshner wire stabilization, but it also includes removal of severe bone wedges from the base of the phalanx. So in 80, what they're saying is it's removal of bone wedges from the base of the phalanx. So when we try to look up phalanx, hold on. It doesn't actually out to not 28297. Option D includes joint orthodesis, a fusion at the first medial cuneiform joint. So that's not an option. Okay, code 289, moving the medial eminence stabilization, the joint with Kirshner wire and closing the patient up. Okay, that's close, but they're saying that's not it. 28292, option B, best describes the procedure, which is accurately in the accompanying diagram. Okay, so let's go to the code itself. 28292. Let's go to the codes itself and let's see how it looks and what is it saying. 28292. Two eight two 92 282 282. 28292. 28292. Okay, so 28292 is correction halux vagus bunionectomy with sesamoid ectomy when performed with resection of proximal phalanx base when performed any method. So it mentions let's go back to the reading. It is the halux. Where did I see that? There you go. It says here the incision, that's about the fourth sentence, about the third or fourth sentence. The incision of medial and parallel of the extensor halacus longus tendon. So halacus longus tendon is a mentioning right there as a bunionectomy. So let's highlight that because that's your keywords, how to find what you need. So an incision. So is it listed under? It's listed under the main topic repair. Okay, it's listed under the main topic repair. Attention was directed to the right foot where using a number 15 blade, a 6 centimeter linear incision was made over the first metatarsal. Metatarsal is your foot. Taking care to identify and retract all vital structures. The incision, okay, incision and parallel to the extensor longus tendon. Okay. The incision was deepened through the subcutaneous and underscored and retracted medially and laterally, thus the exposing capsular structure below, which were incised in the linear longitudinal manner, approximately the length of the skin incision. The capsular structures were sharply underscored off. The underlying osseous attachments retracted medially and laterally. Using the upper tone mallet, the medial eminence of the metatarsal bone was removed, and the head was remodeled. So here's what we're looking at. Medial and parallel of the extensus hallucis longus tendon, which is the foot. The incision was deepened, so they had to go deep into the subcutaneous, underscore and retract medially and laterally, thus exposing the capsular structures below, exposing the foot, which were incised in a longitudinal manner, approximately the length of the skin incision. So we look at this. The capsular structures were sharply underscored off the underlying osseous attachments and retract medially and laterally. Using the osteotome and mallet, which is a hammer and some sort of that they spike with, the medial eminence of the metatarsal bone was removed and the head was remodeled. Remodeled is reconstruction. So you want to put that in a box. You want to draw a box. You want to highlight it, but draw a box. Remodel. Remodeled means reconstruction. Okay, now let's go to the back of the book and find reconstruction. Let's find reconstruction. Go under reconstruction. Okay, reconstruction. And then now we're under reconstruction. Let's find. Okay. So look up foot. Foot. Okay, left. Okay, but halus locus. Okay, it was not listed under here like that. Okay, so let's go to halus locus. H-I. And maybe just the word itself. H-A. H-A. Okay, so we find the word halux. Halux means great toe. So it says see great toe. So let's go to great toe. 282. Halus longus tendon. Okay, it should be under repair. Okay, let's go back to repair. Let's go back to repair. Yes. Go to repair. I knew it was somewhere. Go to repair. You in repair?
Go to repair.
Go to repair. Okay. Now, once you go to repair, go to Halux valgus. Halux valgus.
You said repair and
Once you go to repair, your next breadcrumb is Halux. Hallux.
Okay, that'd be 28292.
It
start from there.
Okay. And then it wants you to go to also 28295 through 28299. And that's how we justify our answer. So circle Halux longus, and then draw out to the side Halux.
Let me say Halux longus.
Valgus.
So medial.
Okay, I'm gonna send you this latest one. You all right, sweetie?
Yeah, I'm just looking for what you said.
Okay.
The Halux.
Yeah. Did you go under repair?
I'm under repair, but I don't see that Halux. What's that other word you mentioned?
Valgus. HAU. Okay, so go under repair. Go to alphabetical order.
Okay, Halux valgus. Okay.
Yeah. Hallux valgus. That's it right there. And that's how we justify that. So words in a timely fashion. But that I wanted you to see how to see it. It was my idea to do.
Okay. You said
okay, I just texted to you.
okay.
Okay. So let's look at number 84. And I think I gave you the rationale to that already, the answer key.
Yes, ma'am. I think that's the last text you've been giving me was a rationale.
Mm-hmm.
Of the answer key.
So number 84, it says a thoracic surgeon makes an incision under the sternal notch at the base of the throat, introduces a scope into the mediastinal space, and takes 2 biopsies of the mediastinal mass, then retracts the scope and closes the small incision. So the rationale says A. A is the answer.
Which number we're?
Number 84. I just sent you a picture of it.
Okay. Okay, yeah. 84, 85.
Yeah. Do you see the questions I sent you?
Mm-hmm.
Okay. Read out number 84.
You want me to read the entire question?
Yes, ma'am.
Okay. A thoracic surgeon makes an incision under the sternal notch at the base of the throat.
Yeah.
Introduces a scope into the mediastinal space and takes 2 biopsies of the mediastinal mass.
Yeah.
He then retracts the scope and closes the small incision.
Mm-hmm.
And I have answers A through D. Let me go back. 39401, 32906, 39000, and 32405.
Mm-hmm. Mm-hmm. Okay, now read the answer rationale.
Oh, go back to the
Okay, so what the answer choice for 84 is, and it says in this question, the surgeon uses a scope to make 2 biopsies of the tissue. Okay, so a thoracic surgeon, let's go back and read the scenario. A thoracic surgeon makes an incision under the sternal notch at the base of the throat, right here, if you can see that, right here. Okay, between 2 bones, Introduces a scope into the mediastinal space and takes 2 biopsies of the mediastinal mass. Then retracts the scope and closes the small incision right up in here. Okay, so A, in this question, the surgeon uses a scope to take 2 biopsies of tissue from a mediastinal mass. Since a scope was used, we can eliminate options C and D. So option C and D is not the answer choice. You can look at them and read them so you can get an understanding and compare to answer A. That's the best thing to do. But C and D is not the choice. C 39 and option D describes a different procedure using a percutaneous needle. The difference between the remaining options A and B is the approach used. Codes 32606 and option B describes a thoracoscopy of the mediastinal space. Okay, so let me hold this up. Thoracoscopy. So right here in the throat, right? They're going to insert and go down. You see how I got my finger right there?
Yes, ma'am.
Okay. So when you're coding, you have to picture what it looks like. Okay. You have to kind of picture in your mind what that looks like. The difference between remaining options A and B is the approach used. The code of the mediastinal space and approaches through the chest wall, where the scope is maneuvered from the thorax into the mediastinal space. 39401 in option A describes a mediastinoscopy in which the surgeon makes an incision under the sternal notch at the base of the throat, and the scope is maneuvered directly into the mediastinum, where a biopsy of the mediastinum was taken or is taken. Okay, so there were 2 biopsies of the mediastinum. So those are the key words. So you have to match. So let's underline. Excuse me. 2 biopsies with your pen. 2 biopsies of the mediastinal mass. The surgeon makes an incision under the sternal notch at the base of the throat and then introduces a scope. Okay. And the option A. So option A is the answer here. Option A is the answer. Okay, let's go to 39401. 394. Let's look at that. I want you to look at that so you can understand your breadcrumbs.
394. 01?
Yeah.
Okay. Hold on.
Hold on, I'm texting my old boss. Okay. I'm sorry, honey. I got interrupted with my old boss from my other job. She's trying to keep in touch with me. Okay, sweetheart. So we did discuss the option A as the answer, right? So 39401. 39401. 39401. Let's see here.
Three 39401 is endoscopy.
Okay.
Endoscopy. That's what it is. Medioscopy includes biopsies of the mediastinal mass. Lymphoma when performed. That's on the CPT code book. What am I looking?
Okay. So mediastinoscopy. Okay. So it's an endoscopy. Wow. Okay. So a thoracic surgeon makes an incision under the sternum at the base of the throat, introduces a scope. Yeah, scope, scope, yeah. Mediastinal space, sternal notch. Okay. So this is what gives us the keyword endoscopy. Okay, got it. All right, sweetheart. We learn something every day. Bless God. Amen. So let's go to number 8. I'm sorry?
I said, well, yes, we do. No,
we learn something new every day. Okay. Number 85. A patient undergoes endoscopic surgery to remove an anterior and posterior ethmoid sinuses. The surgeon dilates the maxillary sinuses with a balloon using a transnasal approach, explores the frontal sinuses, removes the 2 polyps from the maxillary sinuses, and performs the tissue removal. So the rationale for number 85 says, did I give you the rationale for number 85? If I didn't, I'm going to send it to you right now. I don't think I did.
But go ahead and send it to me because I'll have to go back and look and see.
Okay.
Let me see, did I get that for the other one? Let's see what this one was. What number we're on right now?
Number 85, pumpkin. I'm seeing you the rationale.
Okay.
And we're going to end right here.
Okay, that's what I was trying to make sure. Okay.
Yeah, we're going to end right here, pumpkin. Okay, I think, here it is. Let's see if it goes through. Oh, okay. But why the other ones went through sideways? I never can understand it. All right, then. All right, so the rationale for number 85, the correct answer is C. Read the notations below these codes to find out the correct answer. Code 31237 in options A and B states beside it in separation procedure. This means if it was performed at the same time, another procedure is bundled into the primary procedure and cannot be coded separately. We can eliminate options A and B. Options B can also be eliminated because 31201 describes an opening ethmoidectomy, while the procedure in this question was performed endoscopically. 31255 in option C and D accurately describes the anterior and posterior removal of the ethmoid sinuses. So this is the correct code. Code 31295 in option D was also performed and correctly coded. The notation beneath this code, however, states that it should not be used in conjunction with 31267, which is one of the correct codes in the answer. 31267 in options C and D describes a nasal polyp removal. Since we know that the code in 31267 cannot be used in conjunction with code 31295, we are left with option C as the correct answer. Option C can also be deduced by reading the multiple notations beneath code 31256. The third notation states for anterior and posterior ethmoidectomy, the frontal sinus exploration with or without polyps removal, use 31255 and 31276. So the answer for 85 is C, 31255 and 31267. Yeah. So those are the correct answers that you need right there. Okay. Let's go to numbers 1 through 5. Numbers 1 through 5. So circle, make sure that you know that C is the correct answer.
I wrote down C. Yes, ma'am.
Okay. All right, let's go through 1 through 5. 1 through 5. Okay, so the rationale for number 1 is B. B. Let's look at number 1. Let's see what number 1 is saying. Okay, the suffix.
We're going back to med terminology, right?
Yes, ma'am. I'm sorry.
Okay, I gotta go. Okay, I'm ready.
Okay, so the suffix ectomy. Ectomy means to cut into, surgical removal, a permanent opening, or surgical repair. Ectomy. Ectomy. What do you think it is? Without looking at the rationale.
Oh, like excision. What you said, cut into excision. Ectomy. Okay. Oh, these are the rationales. I need to go back to the questions. I'm not looking wrong. Let's see. Adjust. We'll go back through. Oh, that's still the rationales. What's the actual med term? Hold on. Okay, midterm. All right.
Ectomy. What does ectomy mean? What does ectomy mean?
To cut in two.
Okay, cut in two and do what? There's another procedure of what you do.
To remove. Cut into to remove something?
Yes. To remove. Surgical removal. Surgical removal. B is the correct answer, or surgical removal by process of elimination. The suffix otomy means to make an incision into or cut into. The suffix ostomy means permanent opening, to create a permanent opening. The suffix plasty means to surgically repair, Common medical terms like these are often listed in the first few pages of your CPT book. Okay? Okay. Number 2, the acronym MMRV. Well,
measles, mumps, rubella.
Okay, measles, mumps, rubella.
Varicella.
Yes, varicella. Very good.
I just been saying, I almost said vaccine because they talk more about vaccines.
I know. It's always kind of plugged up in your head like that.
I had to think about it.
I know, pumpkin. I know. MRI stands for?
It's D, magnetic resonance imaging. That's only because I have to get those once a year.
Oh.
With contrast. I know what that is, yeah.
Oh, okay, baby. Okay.
Yeah. So I'm familiar with the MRIs.
All right then. Magnetic resolution image. Oh, wait a minute. Hold on. Sorry. Magnetic resonance. Renaissance imaging. I said that wrong. Forgive me. I'm getting tired. I'm sorry. Okay. The term
That's okay.
sapling oophorectomy.
We just went over ectomy, so that's going to mean more of an incision removal. We just went over that part.
So removal of what? Part. Removal of what?
It'll be A. The fallopian tubes. The reason why I'm going to say both, because you got ectomy, you got two terms. Slag low and then orectomy. Those are two terms. Incision, removal of, now, this is just me breaking it down. So it made more sense for it to be A. Two things, because the first half stands for something, a mid-term. So that would be fallopian tube. The second half would be ovaries. Ectomy, excision of removing two things. If it was only one term, then we could have done something totally different, which it would have been, I guess, mostly C, D. But it was two terms. Removing something, so. And I didn't even know what was sampling.
Sapping.
Eggs too, so I hadn't even ever heard of that one.
Oh, yeah.
Probably is a thing, but yeah.
It deals with the fallopian tubes.
Oh, okay.
Fallopian tubes, and then oophorectomy, the ovaries. Okay. Perla. What does Perla mean?
And I've always heard that in medical records.
It says the answer choice is D. This is a rare instance in which the answer cannot be found in the medical coding books. We know that this question or one similar often appears in the exam. It is suggested that you write out the meaning of the acronym and coding guidelines for the eyes and ears just before the code set 65091 through 69990, or in the notes section just after the code sets. So D is your answer. D is your answer. Okay, sweetie. So I'm going to send you some more homework. Yay.
Yes, ma'am.
Okay, let me take some pictures here. You see, I'm going to send you 6 through 10. Oh, did it chop? See, it may have chopped off. Okay, 6 through 10. And I'm going to send you 11 through 15. Let me see what else is in this book. Oh, this is going to be good. I'm going to send you 16 through 20.
Okay, you're going to text that to me?
Yeah. And then I'll text you the rationale when we meet up again.
Okay.
Hold on. (21 through 25) and 26 through 30. And I might send you the rationale later just so you can have an idea how things work, but I wanted to see how you work with that on your own. And then I'll send it to you later. Yeah. Okay.
No, I can do it later.
Okay. Okay.
Yeah.
All right, sweetheart. Well, I'm about to skedaddle out of here. It's nail tip.
Thank you for giving me your time today.
Oh, you're welcome. Oh, girl, you are so welcome. You are so welcome. Thank you for reminding me, because I was just laying up in that bed. And I know me, since the hospital, I go into that deep REM sleep. And Lord help, when the phone rings, you better be glad I answer it, because if I don't answer it, baby, that sleep was so good.
That's fine. I understand.
Yes, but I'm praying.
Thank you, my dear. As always, I appreciate you.
All
Thanks
right.
for the prayer.
Amen. Amen. Anytime. Anytime. All right, sweetie. You have a good day, okay?
All right. You too, Miss Hopper.
Okay. Bye-bye, honey bun.
All righty. Bye-bye.